Well, thank you for the invitation. It's an honor and a pleasure for me to be part of this Congress. I will go to talk about the impact of stigma on treatment services for people with substance use disorder during the COVID-19 pandemic. And it's a work that we made with Necpam people. So I would like to introduce you the network of early career professionals working in addiction medicine that was founded in 2017 during the first WHO Forum on Alcohol, Drugs and Addictive Behaviors. So the Necpam aims to support and empower young professionals in the field of addiction medicine. And starting from 2017, the network reaches 43 different countries, and including low and middle income countries with more than 150 members. So after the beginning of the pandemic, Necpam decided to organize weekly support calls for their members, and in April 2020 we launched a survey to understand the perspective and personal experience of our members on the impact of the COVID-19 pandemic services. So the board designed an online survey, and Necpam members from 19 countries responded to the survey, and responses were grouped in 4 different themes. The first one is about stigma, and I'll go you to present the result. The second one was about alcohol, then access to healthcare and harm reduction services, and then emergency practice in addiction. So, as I told you, the first theme was about stigma, and we produced and published a paper on frontiers in psychiatry with the title of The Impact of Stigma on Treatment Services for People with Substance Use Disorder During the COVID-19 Pandemic, Perspective on Necpam Members, and so I would like to thank all my colleagues, especially Dr. Noah Ahmed Saad and Lisa Dunnett, and our chair Nibana Morgan. Well, when we talk about stigma, we have to take in mind that stigma is a mark of shame, disgrace, or disapproval which result in an individual being rejected, discriminated against, and excluded from the society. Stigma toward individuals with substance use disorder affects the emotional, mental, and physical health of these individuals. So, people with SUDs are often viewed as unpredictable, dangerous, and morally responsible for their condition, and stigma may lead to reduced access to care, inability to make decisions regarding treatment, and forced or coerced treatment. Stigma could negatively also affect the policies and programs intended for the management of addicted. People with addictive disorders may also develop self-stigma, influencing their behavior, including decreased use of healthcare services with consequent poorer health outcomes. Internalized stigma and self-stigma have been linked to increased psychological distress and poorer quality of life. People with SUDs may face significant stigmatization by ethical practitioners. Of significant concern during COVID-19 pandemic is that people with addictive disorder and concurrent COVID-19 may not be provided with adequate care. Therefore, people with SUD may be experiencing increased stigmatization in different countries during the pandemic. This exacerbated stigma and discrimination toward people with SUD may lead to inadequate care or poor attention for clinicians, policymakers, and other stakeholders. To explore this important issue, in March 2020, members of Necpam were asked to share their experience, observation, relevant published literature, and opinions from their respective countries. 14 Necpam members representing 10 countries replied. The countries represented are here listed: And we have Egypt, Italy, India, Nepal, Morocco, South Africa, Ireland, Indonesia, Japan and New Zealand. Regarding access to services, I would like to report what a member from India reported. So he said that patients presenting to treatment service were frequently questioned and fined as police believed them to be in breach of the local COVID-19 lockdown policies. Members also noted that policies have been made to coordinate No policies have been made to coordinate services for patients with behavioral addiction. Also here we can read together what a psychiatrist from South Africa wrote regarding the policies during the COVID and addiction care. He wrote that overall, I think stigma toward people who use drugs has played a significant role in service planning and education, with the sense that these clients may not deserve or warrant the care and attention that people with medical disorders do. This has felt like a worsening of the usual stigma toward people who use alcohol and other drugs. Also regarding the policies, when hospital-based services were planned and restructured, mental health and addiction wards in some settings had been repurposed into COVID-19 wards, with little future planning by policymakers regarding addiction services. An example given from Morocco was that before COVID-19 pandemic, the Ministry of Health had launched the National Strategic Plan of Prevention and Care of Addictive Disorder in January 2018. This program addressed several aspects of stigmatization of people with SUDS, including the rights to access health care and to preserve their dignity. However, during COVID-19 pandemic, there was no official plan to manage the support and treatment of substance use and other addictive disorders. The addiction health service were reduced to a minimum, and addiction input was provided by continued general psychiatric services. Moreover, addiction centers were also used to treat COVID-19 positive mental health care users, as substance users were then offered care when required in psychiatric department of hospitals. Similar situations were reported by Necpam members from South Africa, Nepal. Controversially, a member from New Zealand reported that although the initial health planning and policies were centered to the pandemic itself, there was an early response to address an increase in SUDS and other addictive disorders during the COVID-19 pandemic and lockdown. An initial survey aimed at both service providers and people with SUDS identified the potential negative consequence due to harmful substance use during the COVID-19 pandemic. These included hesitance in seeking professional help, with most individuals with SUD opting for not reaching out for support. Moving with the demand, the New Zealand government mobilized new funding towards fast-tracking mental health services, and emphasis has been made on promoting knowledge about substance use and gambling harms, reducing stigma, and facilitating enhanced access. Moreover, there was an increasing of the use of telemedicine in most of the countries. With the initiation of national lockdowns, services were mobilized to enable emergency placement of vulnerable individuals in line with physical distancing measures. Services have been delivered through digital platforms, recognizing the need to increase such technological means. So that's the end of my presentation. Thank you. And if you want to contact me here, you can find my email, and if you want to be part of Necpam, or if you have any question regarding Necpam, please send a mail to contact@necpam.com. And thank you again.